Hello, I'm P.Srilatha, Chief Dietitian, Medicover Hospitals, Madhapur. Today we are going to know about bariatric nutrition. Basically, bariatric surgery is very popular nowadays. It's in boom with the increasing incidence of obesity and morbid obesity in India. So basically, who are the candidates or prospects for bariatric surgery? So patients who have diabetes or hypertension or cardiac issues with a BMI more than 32 kgs per meter square, and if no disease comorbidities are present, that means a person is perfectly all right without any medical complication and has BMI more than 37 kgs per meter square, is eligible for a bariatric surgery. Basically, this bariatric surgery, we have three different types. It could be a restrictive surgery like a sleeve gastrectomy, or it could be a combined procedures like gastric bypass, or it could be a malabsorptive surgery like BPD, biliopancreatic diversion surgery. So whatever is the surgery, it depends upon the choice of the surgeon with the BMI the person is existing in. So basically, whatever is the surgery, we need to follow a diet which is really important. This post-bariatric diet is classified as three stages. One is a liquid stage diet, second is semi-solids, and third is soft. After the third diet, it is just the normal diet, soft. Soft is just near to the normal diet. So in liquid diet, most of the people will be very difficult to continue this. People who are really foodie and who eat gorge on food are prone to obesity, and they will become morbidly obese, and they are the prospects who do bariatric surgery. So to control their food, it becomes very difficult. In this bariatric surgery, the pouch size of the stomach is reduced from 1 to 2 liters to 100 to 150 ml. So the patient can accommodate very less amount of liquids or food in the stomach. So this is the way they reduce the food intake over a period of time. Their body utilizes the fat and they tend to lose weight. And if a person continues to follow a very good diet with a good exercise, they tend to lose around 30 kgs initially in first year, or could be more than that. So what are the things this post-bariatric nutrition focus on is good amounts of protein, because there should not be any muscle sagging. All we need to restrict is your fat and calories and not the protein. And the diet should be focused on good amounts of electrolytes, minerals, vitamins and antioxidants. So post-bariatric people suffer from hair loss, muscle sagging, cramps. So the doctor places them on some sort of vitamins and supplements. So that is mandatory. Apart from that, when the patient is on liquids, focus more on this. So every second hourly, you can take 200 ml of food which is in liquid form, in between a cup of water to be sipped out, which is really mandatory, so that they will not go into dehydration. So when the person is placed on a liquid diet, at least a liter of milk and milk products should be there in the diet. It could be milk, tea, coffee or buttermilk. And more of caffeine is not allowed in terms of more number of cups of tea and coffee. It could be 1 or 2 cups of tea, coffee in a day and not more than that. Preferably chicken soup, dal soup, all these foods add to good amounts of protein, and fruit juices and some amount of dal soup can be taken, and this is for 10 days. Post the liquid diet will be a semi-solid diet. A food which is in a semi-solid or a dropping consistency can be taken. It could be idli with sambar, which is really mashed soft, or a thin suji upma, or a thin khichdi, or it could be a porridge like ragi porridge or a wheat porridge, or milkshakes which are in a thin consistency, and thick dal soups can be given, mashed chicken soup can be given, lassi can be given, and egg white boiled can be given, and should chew it very softly and eat it. And this continues for another 10 days. And when the person is on a soft diet, ensure that 500 ml of fat-free milk and milk products is in the diet. All the foods in a very soft consistency can be taken, like your oats, cornflakes, your idli, upma, and soft dosa also can be taken without oil. and a cup of curd, dal, and vegetable, and a small cup of rice can be accommodated, and not more than that. Like this, lunch and dinner can be taken. In between, a fruit puree or some soft boiled grams can be given to add to good vitamins, minerals, and protein and fiber. And we should not take fruit juices once we are on soft diet. Try to take only purees and soft fruits. And once if 30 days are finished, then can switch over to normal diet. Remember to restrict the calories. It is basically a less calorie, good protein, good amounts of fiber, less fat, more minerals, more vitamins, and adequate fluid therapy. So walking should be accompanied with that, and junk foods, liquid calories like alcohol and carbonated beverages should be strictly avoided. Green leafy vegetables, dals, fish, egg whites, chicken can be incorporated, and dry fruits and nuts and oil seeds can be taken 15 to 20 grams alternate days. So if we follow this and do adequate exercise, it will be a successful bariatric surgery. Thank you.